Four is a quorum. We've got three, unless Mike probably will show. All right, so good afternoon, everyone. I'd like to call the meeting to order. This is the regularly scheduled monthly meeting of the Dubuque County Board of Health. It is Wednesday, September 20th, 2023. It's now 4:30. I will begin with roll call. First, Patricia Lemkule. Here. Jess Smith.
Here.
Thank you. And Dr. Preeti Joseph. Here. Sandra Larson here. I will say that I know that Adam Hoffman, our scientist on the board, who is the professor at the U of D, is in Paraguay right now doing water research. So he could not make this meeting. And then our co-chairperson, Amy Crow-Sunleaf, has an important family event. I believe it's on Friday. Her daughter's getting married. So she informed us that she had some important scheduling things to do today. So I don't think she'll be with us. Right now, we do have 4 members here, so that is a quorum. And so we can begin. I'd like to start at this time. Anyone may address the board on matters of which are on the agenda. Please raise your hand if you're on Zoom or if you're in the room. And when you're called upon, state your name and home address. Individual remarks are limited to 3 minutes. We have anyone that would like to speak today on matters which are on this agenda? Seeing no one, we will then go on to the chairperson announcements. My first announcement is a welcome to our newest board member, Dr. Preeti Joseph. Has just been, I think it was on Monday appointed to the Board of Health, and we're very happy to welcome you. I will just say a few words. I know that you got your medical degree from the University of Oklahoma, and you were a fellow, a neurology fellow, I believe, at the University Medical Center in Nashville. So you are a board certified neurologist. You're in practice here in Dubuque and also in Illinois, okay. And then, so I just would like to welcome you. It's very important, you know, the Board of Health has to have a physician or another medical person qualified to be on the board. So we're really happy that you volunteered to serve. Would you like to say a few words about yourself?
I'm excited to be here, excited to get involved in the Dubuque community and the county, and try to, you know, make a contribution any way that I possibly can. So happy to be here.
Well, thank you. Welcome. Yeah. We'll just go around the table so you can know who the other board members are here. And I'll start with you, Mike. Would you please introduce yourself and let her know a little bit about you?
Sure.
Thank you.
I'm Mike Fidgen. I'm president of Hillcrest Family Services up on Asbury, and been in Dubuque now for just over 3 years.
Thank you. And Pat,
I'm Pat Lemkule. I'm a nurse, and I work in infection prevention at Unity Point Health Dubuque.
Jess, would you introduce yourself, please?
Hello, my name is Jess Smith. I am the director of pharmacy for Mercy One here in Dubuque. And then I also have a background in public health, health promotion and disease prevention. And I did some work at the University of Iowa in that arena. Good to have you.
And Jess missed our last meeting because she was busy delivering a new daughter. Congratulations, Jess.
She's asleep. If she decides to wake up, I'll show her. But
okay,
yeah,
all right.
She's 4 weeks old. So.
Oh my goodness, thank you. And I'm Sandra Larson. I'm a retired nurse and attorney. I practiced law in Michigan for most of my adult life. I was a divorce attorney. And I retired a few years ago, and I moved back to Iowa. I grew up in Iowa, so I moved back to Iowa. Not the Dubuque area per se, but I was familiar with Iowa, and I was happy to come back. It's just a simpler lifestyle here. And I've been on the board for 2.5 years, I think, and I've been the chairperson for this is my 2nd year. So again, very happy to have you. Next, I mentioned that Adam is in Paraguay. And then the next thing I wanted to mention was that Iowa Immunizes is going to be here. Diane Freiberger gave me some information. I'd just like to share it with everybody. Iowa Immunizes is going to be here in Dubuque, and they're going to be working with children at the farmers market from 7 a.m. to 12 noon on September 30th. There'll be fun things for the children to do, and they'll be learning about immunizations through fun ways. And so that's on the 30th. And then on October 7th, Iowa Immunizes will be at Kids Expo at the Grand River from 10 a.m. to 2 p.m. doing the same thing. And we are invited to, us board members are invited to come down and help in any way we can if we are free and would like to do that. And thank you, Diane, for that information. Next, we have a Board of Board of Health liaison comments, and I see Ann McDonough is on Zoom. Do
Yes.
you have anything to say today, Ann?
Well, good afternoon. I would also welcome Dr. Joseph to the board. We had several applicants, and so that was exciting to have continued interest in serving on the Board of Health. That's helps make it just helps roll forward all the work that we need to do when we have qualified candidates to choose from. So that's exciting, and look forward to working with Dr. Joseph. And I guess the only thing I would comment with regard to that, Allie and I chatted briefly about that it would be, I believe, the responsibility of the director of the health department to onboard, so to speak, Dr. Joseph to acquaint our new board member with policies, positions, committee assignments. You know, that would be what you would want your director to do, I think. And certainly, you know, as chair, Sandra, you might want to do that as well. But that's been my experience in my 5 years on the Board of Supervisors. New members are onboarded by the health director when we have one, and we have Allie, so settling in well to that. But I don't have any other announcements. I think anything else the board has done will be covered by Allie in her report. So thank you.
Thank you. I do know also, Dr. Joseph, that our regional director, what's her name? Becky Nowacek, she will want to meet with you also to give you sort of an orientation. So, and she'll do that over Zoom if that's convenient for you. All right, going on then to our next item, it's the approval of the agenda for September 20th. Is there a motion to approve?
So moved.
This is Jess. I'll second.
Thank you. It's been moved and seconded that the agenda be approved. Is there any discussion? Hearing none, then let's take a vote. All those in favor of the agenda say aye. Aye. Those opposed? Okay, the agenda is approved. Next, approval of the minutes. We have the regularly scheduled Board of Health meeting minutes for August 16th, 2023. Is there a motion to approve?
So moved.
Is there any, this has been moved and seconded that we approve the minutes. Is there any discussion? Hearing none, let's take a vote. All those in favor of approving the minutes, please say aye.
Aye.
Those opposed? Hearing no opposition, the minutes are approved. Item 7 on our agenda, presentation and reports. First, we'll start with the VNA report. There is no one here from the VNA, correct?
Correct. Stacy was not able to make the meeting today, but she did provide us with some written information, which is part of your packet. Should you have any questions after reviewing that, please feel free to reach out to myself. If I can answer your questions, I'm happy to do so. Otherwise, I'll consult with Stacy and get back to you.
I didn't see, no questions came to my mind when I read the report. Anybody else have any questions? I did hear from Stacy today earlier though that she's feeling better, so I'm glad to hear that. She thinks she'll be back to work soon. Next we have the DC PhD report.
It was getting to be a mouthful.
And that is,
Public health department.
yes, the Dubuque County Public Health Department report will be given by our director, Allie White. Go ahead, Allie.
Thank you. I'm going to go ahead and share my screen here, hopefully. Okay, we can see that here in the conference room. Can you see it on your end on Zoom?
Yes, we can.
Great, thank you. All right, so within our department, we are growing. I am happy to announce that we are growing. At the last meeting, we discussed the public health coordinator position, which was posted from August 18th through September 1st. We had 14 applicants, many of which were very well qualified. So that was great. Of those 14 applicants, we interviewed 7 with just an internal team here for interviews. And then we invited 2 back for second interviews and are preparing within the next day to make an offer here to one of those candidates. So that was exciting. I met with our IT department recently to review our scanning project plan. As you know, we're looking to go from paper to digital. And that process is moving along. I would estimate within the next week or so, we will actually be shipping out many of our records related to county properties. We'll be shipping them out to a third party who will do the scanning for us. And that will free up a lot of space, which we're going to need in our department. And again, that third bullet there, just looking at utilization of our space as we grow, we need places to house all of the staff members. And I'm hoping that by clearing out some of the storage that we have with filing cabinets and such, we'll be able to make enough office space for everyone. But again, I'll be looking at that in detail in the coming weeks. I had the opportunity to attend a poverty simulation exercise that was in Delaware County at the end of August. Just lots of good takeaways from that. We actually simulated what it is like to spend a day as someone who is trying to balance work, daycare, getting transportation, food, all of that. It was eye-opening. It was good. I also attended a workshop that discussed the 10 essential public health services. And I think I've referenced before, I would like to use those 10 essential services to kind of carry forward into the reports that I give the board each month, and then kind of help use it to guide the work that the board itself is doing as far as like policy and assurance and those type of things. So more to come with that. The state level, I attended the local public health collaborative in Des Moines last week. There were 98 representatives from 96 of the local public health departments, all administrators. So it was a good opportunity to network and see what's happening in other areas of our state. Locally, I met with the ISU Extension Office on the 31st of August, and together we identified some great opportunities to collaborate and provide some education and training together in the community. We like to touch base on the opioid epidemic. It was approved by the Board of Supervisors on Monday that we can go ahead and post the position for a public health project coordinator, a position that will be funded entirely from the opioid settlement funds initially, and dedicated specifically to managing those funds, assessing our resources, and making recommendations on how we may implement. So recommendations that come forth from the work that this person will be doing will be reviewed by myself and then brought to the Board of Health and to the Board of Supervisors, who will make final decisions. But we're really excited. I have a laundry list of things that I would like to be doing with regards to the opioid pandemic that just don't happen because there's not enough time in the day. So I'm really excited to get that off the ground. I do need to send a formal invitation, but I believe the next opioid subcommittee meeting will be September 28th.
hybrid format from 1 to 2 p.m. And I'm looking to have a presentation from a community member during that meeting. We continue to work on the community health assessment. We had broken up into focus groups, and those focus groups will conclude meeting this week, and then we'll transition to kind of bringing the data together and formalizing it into a report. And then just a couple of upcoming events. We'll have a strategic planning virtual work session next Friday from 8 to 10, and that will be facilitated by our strategic planning consultants, Evidence Analytics. And they have invited a smaller group for this session. So those that they had kind of suggested that we include in this meeting have been sent invitations to kind of hold that date and time, and further information will be coming from the planners as far as the specifics of that session. Myself and Bailey, our environmental specialist, have registered and will take a grant writing 101 course through the ISU Extension Office first week in October. And then finally, we have a service area in our county, or I'm sorry, our state is broken into service areas for local public health services. We're part of Service Area 6. They meet quarterly, and we're seeking a venue for the next meeting, which will be held the end of November. And so I did volunteer to host for that meeting and have secured a room at the Piasta campus of NICC. So looking forward to showing our friends across the state what Dubuque County has to offer. So looking forward to that. With that, I would welcome any questions.
That's great. I just want to call everyone's attention to the fact that this was a report for September 2023. This was not the last 6 months. She's doing all of this. I mean, she's just doing a great job. I'm just so happy with how you're functioning, Allie. It's just, I'm very pleased with it. I wanted to say one thing about the opioid position that you secured through the Board of Supervisors. You shared with me that you gave a presentation and then they voted on it and it was unanimous, correct? So I'd like to congratulate you on that. I think that's hard to get a unanimous vote from 3 supervisors. So congratulations. I think you did a great job with that. With that, I have no other questions. If anyone else does, go ahead. Okay, thank you. Next, we have a special presentation by Alexis Miner. And she's going to be speaking about the Hillcrest Lockbox Initiative presentation. Allie, did you have anything that you wanted to add or anything?
I'm just happy to have been able to welcome Alexis to our meeting today.
Yes, that's great. Thank you.
I think this came up too in the context of the opioid settlement funds and Narcan availability, and at some point, Janae Schmidt who Alexis is a colleague of Alexis's, had brought up in one of our public health meetings, the lockbox. So this was a follow-up to that discussion. And Alexis is the best person. She's in charge of Hillcrest community outreach. So
Great. So we're anxious to learn a little bit about this program. So you have 10, 15 minutes.
Sure, thank you. So I was unable to send my presentation to Allie, but I can send it, or I don't know how you would like to do that presentation, but I do have physical copies of the presentation as well too.
Okay.
Yeah, okay, we will do that way.
If you'd like to send it to me afterward,
I can,
and I can send it out to.
I think it may have been because there's some images in there. I like to be able to show images what I'm talking about, and I think that it was a little bit too bulky in there, so. And it should not take a total of 10 to 15 minutes. I don't think it will be that long. Thank you. So ultimately, kind of starting with that first, so I'm Alexis Miner with Hillcrest Family Services. I oversee 3 of our community outreach programs, and one of that is encompassing our HIV, STI, and hepatitis C testing program, which is funded through the Iowa Department of Health and Human Services. So that's a grant that we have continued to foster with Hillcrest and continue to do work within that program. And one of their biggest key points of offering that to the community is also harm reduction. So looking at harm reduction, it is meant to be a proactive and evidence-based approach to reduce the negative personal and public health impacts of behavior associated with alcohol and other substance use at both an individual and a community level. So more or less, harm reduction is an important part of a comprehensive approach to ensuring that people with substance use disorders, as well as additional concerns with prevention, treatment, and recovery, can not only have resources, but understand where their goals are. And then as well as incorporating a spectrum of activities. When we talk about harm reduction, that can be a number of things. So providing resources to prevent individuals from increasing harm risk, or is as well as preventing individuals from causing harm to other individuals as well too. So with that being said, I brought the statistic of by the end of December 2021, there were 15 confirmed or probable cases of hepatitis C in Dubuque County. And there is no current data for the end of 2022 at this moment. So, and in addition to that, there were 82 Iowans living in Dubuque who were diagnosed with or living with HIV, and that's per 100,000 people. So, looking at that, we were given additional funding with the Iowa Department of Health and Human Services to offer a lockbox to the community as an initiative for harm reduction. So when we talk about a harm reduction lockbox, it's not a needle exchange program. It's not promoting the use of substances, but rather providing the resources for people in the community to not spread additional infections in the community, as well as to provide resources and the understanding that we can't necessarily stop people from using substances, but we can support people in the areas where they do need that support. So rather than offering them the opportunity to potentially infect themselves or infect another person with hepatitis C or HIV due to sharing of needles or non-sterile injection site cleaning, that could potentially prevent the use of the lockbox as a initiative to prevent some of that from going into the community. So we are also trying to bring this to the Board of Health to offer this as an addition to the community. We currently have one lockbox that is located at our New Day walk-in clinic that is located with Hillcrest. And in that lockbox, there are needle disposal boxes. So boxes that would trap a needle in a closed container and allow for it not to be accessible to the community. And that aspect, and that would also be for people who are utilizing needles for syringe purposes for insulin and other things like that. Understanding that needles are used for other things other than injection-based drug use, but we do really want to focus on providing those resources to our people in the community who are using injection-based drugs and let them know that there are resources to prevent infection, but also resources to seek treatment and assistance if that's what they're looking to do. So our goals with the lockbox are to decrease those infections of HIV and HCV transmission and decrease the potential of overdose deaths and increase access by initiating the commitment and the unanimous harm reduction effort in the community to like I said, understand that we can't prevent people from using substances, but we can provide them with resources to ensure that they're being safe and not endangering anybody else in the community. So in our lockbox, we include education. We can't necessarily put Narcan or naloxone in there due to it being a not temperature controlled box, but we can put in information about referrals and vouchers to get naloxone. We have information on our testing services, which we offer HIV and hepatitis C testing. We also offer PrEP information to prevent the contraction of those various potential infections, as well as additional education on what other resources are available in the lockbox. So there's a code that accesses the lockbox, and it's not necessarily accessible without that code. So it does not necessarily make this box available to anybody in the community, but people who have access to the code to access the resources that are inside. And we also have bleach bottles to sterilize surfaces, wound care kits, which encompass Band-Aids, a gauze pad, an alcohol prep pad, and an antiseptic. as well as sterile water, alcohol prep pads, and hygiene kits. So including like a toothbrush and toothpaste if it's not too hot, and trying to make sure that we have temperature controlled items available in there. We with Hillcrest are very true to understanding where our drug paraphernalia laws lie, as well as where our parameters are within what's available and legal to put into these resources. So we don't necessarily allow for or offer needles, tourniquets, syringes, cotton fillers, or cookers, or those kinds of things, because they're not necessarily allowed in Iowa. So we don't necessarily promote them as a harm reduction resource, but we do promote them as if somebody is looking to continue utilizing a substance, we can provide them with resources to access safe materials, but we ourselves cannot offer that necessarily. So that comes to the next thing would be the opportunities for the Board of Health to not only support or assist with this involvement. The first step is ultimately, I appreciate you having me here to have this discussion and talk more about the lockbox. And then the next thing would be providing any additional location options, or kind of seeing if this would be something we'd be wanting to bring out into the community. We currently have one location, which we've noticed with it being at the New Day Clinic, it has not been accessed as much as we would like it to be. And we'd like to make this more open to the community for them to be able to have as a resource. So maybe looking at a more publicized location, but also understanding that some of our clients or some of the people who may be utilizing this are fearful of that stigma. So how can we have it in an area where it's not going to be policed necessarily, but it's going to be understood that these are resources for people who are trying to help themselves and trying to potentially reach a more safe point in their life. So, and in addition to that, that would just be, if there are any additional items that we would want to include that are allowable and state allowable, or if there's any additional support that you may be able to offer Hillcrest as it just another foot in to make sure that we have the support behind us within the community and those kinds of things to ensure that this is a resource we want to continue offering to the community. And if so, how can we make this a more accessible resource to the community? And is it that it's the location? Is it that we don't have enough funding to support it? I'm not really sure. I wanted to have just a general discussion and bring this to you and have more, if you have any more questions.
I had a couple questions just that
absolutely.
came up. You said that only people who have the code can access the box. So how do you have access to the code?
So we have flyers that we hand out. Many times we'll hand them out or we'll give them to, and I have plenty of flyers. So if you want to take them, feel free to do that. The flyers have the lockbox code on them. Most times we will give them to providers who come in contact with clients who either use substances or who are potentially using injection-based products for like insulin and those kinds of things, and they don't know where to or how to properly dispose of or ensure that those things are not getting out into the community. And we also have flyers in the lockbox as well. So most people, when they come in contact with the lockbox, they will then have a code that they can take out and then share with other people too, if they need to access that.
So then the code is always the same.
The code will always be the same. It will never change.
At Hillcrest, do you have it in some sort of private place? I mean, is that what you would be looking for? Like I was thinking, I don't know, maybe the V&A building, which is right downtown.
Sure.
Someplace, but then I was thinking there's not really, I mean, they've only got like a public lobby. And so that would be way out in the open. You wouldn't want to put it there, so.
Right. I think ultimately our goal is to ensure that people who are wanting to access this resource are not fearful of the stigmatization, but also not fearful of the judgment of, oh, I'm utilizing this resource. Is somebody going to come and tell me I can't use this resource?
Yeah.
Right now, we've had it located under, I'm gonna say it's an Armada. I'm not really sure.
Foyer or
Yeah, like a foyer area, outside of our A New Day walk-in clinic. And there's a Sharps box, like a large Sharps container there as well too. Many of the times that it has been encountered by clients is when people from the clinic will take clients out and show them the lockbox and what it's used for and how to use it. But most times I think a lot of it is that fear of it's right in front of that clinic area. People are concerned about if they don't go maybe at night, then are they going to be seen? or what that may look like. We very much piloted this in this location because we knew that we would have the staffing to be able to understand what's in the lockbox, what needs to be replaced, and how we can move forward with those things. But in the case that we would offer it to the community, we would ask for additional community partners too, if they wanted to put things in the lockbox, be able to understand who keeps track of that and how we can make sure that their supplies are being utilized properly. Yeah.
And you said that it hasn't been accessed as much as you would have liked, but it has been accessed.
It has, yeah. I had recently, one of our substance use providers in the clinic had said during one of our huddles that they had a client who was looking for sterile products. And they had brought them to the lockbox. They had seen that there was wound care supplies, there was bleach bottles to be able to sterilize that surface, as well as educational material. They were able to collect some of those things and take that with them. But then also understanding too, we've had people who have requested to have sterile needles available in the lockbox. With it being located on our Hillcrest campus and with needle exchange not being an appropriate thing for us to do in the state, we do not encourage that, but we do know that there are other people in the community, other harm reduction locations where they can access some of those things too. And we can put that resource in the lockbox, but we would not encourage putting the actual physical item in the lockbox.
And I think you kind of answered this question because you said you started it here, but like if I wasn't familiar with Hillcrest, like, is this information somewhere else so other people would know about it, or is it mainly more contained right now to the Hillcrest population?
Right now, it's mainly contained to the Hillcrest population. I've done my best to try and make the hospitals aware, like our emergency rooms, and some of the additional other hospital locations available to who work with clients, to let them know that this is available. And it's very much word of mouth at this point. But I'm happy to share flyers and any additional information wherever I may, or wherever that may be wanted. So, yeah, thank you, I appreciate it.
Ann McDonough, you have your hand up?
Yes, thank you. I'm so pleased that you're here. So thank you for being here and making this presentation. It's very helpful to me. I'd like to share, I think, an anecdotal experience with you that I think might be a model for a way for Hillcrest to think about this. And certainly if the county partners, I would want this to be a philosophy that is considered. My friend and I started the Red Basket Project. I think it's been 7 years ago. And the idea was that women bleed every month and menstruation shouldn't be stigmatized, and there's not access to products, and lack of access to products, girls don't go to school. And all of that's true. We know that. We decided to put the products where the people were. So you didn't need to have a code to get some tampons. You didn't need to have a code to get anything. We have spent the last more than 6 years trying to intersect. It's easier to find women, right, than it is someone who's using an illegal substance. But all the same, the idea was to, if you're going to erase the stigma, if you're going to try to make this be something that someone's going to use and be a more productive person in life. I mean, we had girls not going to school. It still happens. So is there a way? I don't understand why you need an access code. What's the fear? What is the reason to not have these products available? As you say, it's not sterile needles. It's not a needle exchange. I think the bleach might be problematic. They should be these kits should be in the bathroom at the VNA. Anybody who's using public health, they should be in our bathrooms right now on the West Campus and down at the courthouse, just like feminine hygiene products are. I just would want to, ask people, the one thing we have found in our 6.5 years doing this is that people don't take what they don't need. There is not street value that we can discern to a tampon or menstrual pad, right? There's just not. There's not a way to bargain that for illicit drugs. I don't know that there's a way for someone to find street value for the simple things that you have in here. You have, wound care kits, antiseptics, cotton swabs, alcohol strips. That's how I think you make this maybe meet the greater need of the community. If I don't understand why you need a code. I'm just not understanding that. When we started the Red Basket Project, we had principals tell us, well, you couldn't possibly put tampons in the high school bathrooms because, girls would soak them in alcohol and get drunk fast. Yeah, ouch, not gonna do that, never did that, not a thing. And I also had a school nurse, Allie, it wasn't you, my dear, but a school nurse tell me, well, you know what? You can't have dry cotton swabs in schools. They can be used to start fires. Hey, if that's where we are as a community, then we really need to rethink a lot of things, that we can't put out helpful products because someone might use them for survival purposes. I don't quite know, but I like the discussion. I think it's an important topic that we raise, but I would challenge you to use the red basket model, to make it available in a way that is helpful. If you're concerned about, them, honestly, the first 3 months of the project, Beth Gilbreth and I self-funded it ourselves. We had no idea what we were hopping into, but honestly, people do not take and use and abuse this. They take what they need. And I think the access code, I wouldn't, I'm one supervisor and the others can't chime in because we would form a quorum, but honestly, an access code is a deal breaker for me. I would need to know if it has to be an access code. Jess, you need it in your pharmacy, and you need it in every pharmacy in the city with the access code up on a billboard or something. So I'm delighted that you're doing the work. This begins a very small project of what's needed. Not one thing you describe truly saves a life. Folks who don't have access to sterile needles are using needles. They are sharing them, and they have, all of the diseases come way beyond Hep C. So thank you for that. But those are my comments. And I guess my question would be, why the access code and when will you remove that barrier?
Thank you. Go ahead, Alexis.
Yeah, the reason behind the access code is this is replicated after what Lynn County has previously done. Lynn County has a lockbox at their public health location where they do have access, and they do have community partners who have put in tourniquets and additional supplies such as needles and those kinds of things. The reason we have mimicked that is because we were utilizing this as a pilot project, more or less as seeing the impact that we have in the community with offering harm reduction and how we can increase that impact. In the case that the box itself has a code on it, and that's how you access it. It is meant to be a lockbox. In the case that there are additional community partners who would want to put resources in there that we, from our grant, would not be able to purchase to put into the lockbox. So in the case that it is out in the community and there are additional community partners, say from the Dubuque Harm Reduction or Iowa Harm Reduction, who may have access to sterile needle products, and they would put those in there, that would warrant the need for the lock and the code to ensure that that's not easily accessible to say a child who comes across the code and they say, well, I know what this code is, now I can go and I can access this. That may not be the situation for everybody, but I mean, we work with a number of different clients with a number of different situations, so.
I'm not understanding. The code is on the box,
Yes.
but you can't tell people the code. They have to know that the code's on the box to go find out about the box. I don't understand that.
The box itself is a locked box, so similar to like a safe, it has a code
Sure.
on it to input and then access the supplies inside.
So you could walk up to the box, if you knew the box was there, you could walk up to the box and the code's right there. No.
The
It's
code is
here.
on the
Okay.
form.
Okay, I
Yep.
get it, yeah.
I'm still
I wonder-
confused. I'm still confused, Sandra, if you don't mind.
Yeah,
This
I
to me-
understand.
Yeah, well, I don't get it.
understand. I'm
Where's
gonna-
the code?
Let me follow up with a couple of questions. Is this maybe in anticipation of putting Narcan in there also? I mean,
It's not a temperature controlled setting, so there would not be anything that would need to be temperature controlled available to be in that location.
and Narcan is?
As far as it needs to be kept at a certain temperature, in order to maintain the validity of the product itself. So I wouldn't want to, for example, on a hot day, I wouldn't want to have Narcan in there and have it go bad or not be able to be used because it was ruined because of the heat or something.
I mean, I think from a pilot program standpoint, it'd be kind of important to know how many people are accessing the box. And so if you have a code, then you could kind of tell how many times it's been accessed.
I have a counter in the code in the box as well to know how many times it's been opened.
Okay, yeah, yeah.
Mhm.
So you could do it without a code, then you could keep track of how many times people come to it.
Potentially.
Okay. So it's not the state program that's requiring you to have a code on it?
It is what was proposed as a pilot with the state, and that's what we had took, and we were utilizing department funding from the Iowa Department of Public Health or the Iowa Department of Health and Human Services to support this as a proposed effort in the community. We had noticed that Lynn County was using it and it had made a really great impact. We as Dubuque, as another integrated testing service site that we utilize those services, we wanted to bring that to our community and see if it would do any benefit or if it was just a pilot that flopped. But that's what more or less the effort is, to try and see. We noticed that we brought it to the New Day Clinic, and we did notice that there wasn't a whole lot of receptivity with it, trying to think about some of those factors. And then trying to take it and bring it here and seeing if maybe it is a location issue, or maybe it is what is accessible in there? Is it too accessible? Do we need to offer and have it open to more community partners to have some of those additional discussions?
So the state's not requiring you though to have a code on the lockbox?
That is just the box that was purchased. It's not necessarily a state thing, no.
Okay, because I'm just thinking if the county decides they want to support this,
Mhm.
we could possibly go on forward without a code.
We could most definitely do that, yeah.
Okay, all right.
Yeah,
Or you could even technically put a sticker on the box that says, if you walk up to the box, press 1111 here.
Right, right.
Right, I mean, I think of it as, there was a decision to buy that, if I'm following the logic,
Yeah,
I'm
you
not
got it.
as deep into this as we're questioning
Sure,
it, but.
sure.
If you, they bought a product that is like, if you bought an American Tourister and it happened to have a lock, and if you close it, it locks. It might default to all zeros across it, and you just have to push the button and it opens, but if you change the numbers,
Yeah.
or you can set it to change it, et cetera. So I think there are probably ways to achieve what Supervisor McDonough is talking about. And then I'm also hearing you say that, you modeled it after another pilot or place that had bought something or had something similar. And there's also the idea that, well, what if it isn't just a non-tradable, street value thing in there, to exaggerate, to make a point, if you have rubber bands in there, okay, no great value. If you decide you want to help with poverty and put gold bullion in there, you might want to have it somehow or other locked and coded to make sure that the people that are going to use it or take it for the right reason had some security. But I appreciate the discussion and would imagine that it can at some point be turned off. Or I think the other question that I hear you raising is location, right? Okay, is this, and that came up too, is under a foyer, is there stigma attached with that if people are coming and wanting something? This location is on our campus. It's the old school building, or a new school building repurposed. It's right across from Flora Park. And we probably see in excess of 200, 225 people through there a month. Not all of it, a small percentage of it is substance use related. So that's not, it's a small number.
And then is the state giving you financial help with this program? Or if, let's say that the Board of Health wanted to get involved, would we have to have the money available to go out and buy a box and do all that?
Not necessarily, no. So when we had taken on the initiative, we purchased 2 lock boxes because we had the anticipation to bring it out into the community and do an additional lock box. It's meant to be, or it's called the lock box because there's a lock on it and it locks. It's very much meant to be the initiative of harm reduction in the community. Understanding that in other areas, they do have the lock box to service and provide additional community resources in there. Then I apologize, I lost my train of thought. What was the question?
I think you answered it. So
Okay.
that's fine. Well, so we were wondering if we'd have to pay for it, if we got involved.
Absolutely not, no. So okay, that's where we were. I have two boxes, one that is currently placed at Hillcrest Family Services and one that is currently waiting to be placed somewhere else in the community, whether that is an addition on our campus or if that's in another location. We're trying to find another location that would be willing to, but with the Board of Health's support and supervision to have that kind of discussion. And knowing that it's out there, how can we encourage to have that? The resources that we would be able to offer, so the wound care kits and those kinds of things that I had described that are currently in there, we pay for with our ITS funding. So the funding that we get on a yearly basis to support the testing and those kinds of things that we do. So there wouldn't be any initial cost, but potentially some follow-up if you're wanting to put additional materials in there that maybe we don't have access to purchase on with our funding.
Okay.
Specifically.
Well, I think, it sounds like a good program to me. I mean, I think we'll have to discuss it. Go ahead.
Couple questions. The first is, are there any state regulations to keeping bleach in a public space? I mean, is that the issue with the lack
Not necessarily.
of the chemical?
Right, I mean, we promote the use of the bleach bottles to sterilize the surface, and if they were to need used, we wouldn't encourage people to sterilize their needles with it, but if that's what they have and that's what they're available to utilize to sterilize, then that's what they may use that for. We've been given state approval from the Health and Human Services to have the bleach and the saline water available, or the sterile water available in there, but nothing along the lines of like fentanyl strips or anything like that. Those are things that we don't have the state capability, but also the legal capability to do, so.
And then the second comment I have is, if we have data on how many HIV and how many Hep C cases we have in the community, is there a way to narrow that down a little closer geographically? So then we can figure out where to put a black box that might be utilized. You know, instead of in a broad sense, can we say, okay, well, there's a concentration of individuals that have HIV or Hep C, and we from that think that there might be increased utilization in that area.
Excellent point.
You know, they're reportable, so the state would obviously have those numbers. If they would give them out, would be.
Questionable.
I
We'll have to see.
don't know, but I mean, I don't know that, I mean, they would have it because like I said, they're reportable, but I just. I don't know how, I just don't know if they report that out.
So I think we're all kind of in favor of this, but I think we have to kind of, take a step back and, have further discussion about it. And then we're also, getting involved with the opioid settlement funds, distribution. And so we'll be having an employee soon that will be, zeroing in on this type of thing totally. So we might not act until we have that person on board, but it does sound like it's a good program. Ann McDonough, do you have another comment?
Yeah, I guess, I think the bleach idea is very dangerous to be out in the public. That kind of gives me the willies that if we have a no access code, you could have a kiddo think it's Kool-Aid and you would have, irreversible harm happening. That to me is that only could be under some kind of lock, in my opinion. I don't know that you can have bleach available in the community in a small bottle. That would be that's an attractive nuisance, strict liability kind of thing. The only other thing I would ask is there anything that Lynn County is doing in their program that we chose not to do? I mean, they don't have the red basket in Lynn County. So I don't know if Lynn County, if there's anyone who's using this kind of box for sterile needles, is Lynn County doing anything in their project that we chose not to do at Hillcrest?
I sure can follow up with that more specifically, but with the pilot on our end, we kind of took what we had proposed, and that's where we're at. We proposed and we had the lockbox shipped and kind of installed in October of 22. And since then, we've been really trying to get it out in the community and having that discussion with folks to let them know that the resource is there. And trying to encourage that to be a discussion amongst providers and those kinds of things to ensure that we can make it a resource available.
If someone suggested to you another location that you found acceptable, would you then go ahead and do that, or do you need a partner in that space to do the switch out and the keeping an eye on it?
I mean, I'm sure that Hillcrest, with it being a proposed aspect on our end, we would definitely do our best to make sure that that is staffed and checked on. In the case that there's an additional person who wants to support and help out in that aspect, we would welcome that support. But with it being a pilot project of ours and us trying to bring it out into the community, we would very much be the ones who are doing that tracking and those kinds of things. But as community partners come involved, that would be when
That'd be great, yeah.
that would be their involvement.
Great.
Yeah.
Go ahead.
Are there, so, you know, in the hospitals, when surfaces are clean, they're not cleaned with bleach, there are wipes that are clean, utilized that kill HIV and other viruses and things. I mean, is that a possibility instead of putting bleach in there? And maybe that'll allow us to have more access to individuals. I mean, just trying to find an alternative to.
We sure can see, my one thing with potentially the bleach or with the, with having wipes would be, with it not being a temperature control, we can't necessarily determine how hot or cold it's going to be. So I don't want for, something that has to stay wet to be able, or that may or may not, be able to be utilized when it comes in contact with that person afterwards. So, I appreciate the suggestion though. That's really helpful. Thank you.
Jess has a question.
Okay, Jess, hi, you have your hand up, go ahead.
Yeah, I just had a question. How often are you guys kind of reviewing the box or filling it or, assessing the supplies? And I just asked because I love the red basket idea. My assumption, Anne, is that they're in schools and so, kind of someone is looking at those on a routine basis. So that may just be slightly different than what we're looking at here, especially if we're going to have the opportunity for community members to drop things in there. So is it like weekly that someone's checking that or?
Yeah, we check our box weekly. And most times if we notice that there hasn't been anybody who has come in contact with the box and we have noticed that there hasn't been anything taken out recently, we may check it a week and a half to try and just see if there's any, if there has been any receptivity or if it's been utilized anymore over that time frame.
And Jess, the way the Red Basket does it is that every person who adopts a Red Basket, Medical Associates has them in their women's restrooms. Their facilities, their facilities people just keep them full. In the schools, actually, the girls in the high schools take care of it themselves to their leadership teams. So, it's just done as part of a routine basis. And again, that's how I think it gets out. And it's just hopefully everywhere because people are taking care of their own community.
Thank you.
I think we may just want to have, as we kind of roll it out in the community, some way to ensure that it's being, they're being reviewed and assessed to make sure there's nothing in there that could be harmful to somebody else, if kind of they're open for access by anyone in the community.
Yeah, that's another consideration. I mean, someone could come along and put something in there, right? Sure. Yeah. All right. Well, very good. We'll take that under consideration, and I really appreciate you taking your time and coming and giving us that presentation, and we all learned a lot from it. So we hope we can get involved and get that second box out. I mean, if it's sitting there, it needs to be out. It really does. So
Kind of just hanging out right now.
we'll find a place.
I appreciate the time. Sorry it took me a little longer than 15 minutes.
That's good. A lot of interest in that program. So very good. Number 8 on our agenda is action items, and we don't have any action items tonight. Next, we have response to public questions, and I did not receive any public questions during the month. Did anyone else? Next, we have unfinished business, and there's one item under that, and that has to do with the after action report after the COVID pandemic. The state requires that all entities make a after action report concerning how we did on taking care of that pandemic. So we finished, the county had a consultant and they finished their report and it's been submitted, I believe. And once that happened, I heard from our former director, Patrice Lambert. She saw in the newspaper that there had been an after action report, and then she did some research and found it on the county site and was just amazed that she never received any contact to be interviewed. She was the person that was directing the health department during the pandemic, and she never was contacted for any comments. So, we did a little research. Once she told me that, we did a little research. Ally got involved. She talked with the consultant, and we did hear back from the consultant, and he gave us the email and the phone number that he contacted her with, and both of them were incorrect. And the email was missing one letter, and the number, I don't know where that came from, because she said it was never her number. So I wanted to bring that to the board's attention, because we have an after action report, and actually nobody from the county health department was interviewed concerning that. And it's not that they didn't want to be interviewed, they just never got contacted by mistake. So what does the board think we should do? Should we do something about it, or should we leave it, or should we contact the consultant? I mean, there's lots of things, lots of actions we could take. To me, it seems like the consultant needs to be notified that he had the wrong information. And then maybe he'll come up with some solution. I don't know, but I do think it's kind of important to get her input.
It is, because I think it presents a different picture. I mean, because there are a few lines in there alluding to the fact that there, you know, the information. So I think it would present a different picture, and it was through no fault of her own. She wasn't contacted.
Right, no.
So it doesn't seem like it would be as complete without all
Correct.
the information in there.
That's what I think too. So I agree with you. I agree with you. So I think then it's kind of a consensus that we would contact the consultant, let the consultant know that this happened, and that we as a board think maybe there should be another look.
I mean, could at least be an addendum.
Yeah.
You know, contacted, this was, you know, information given or something. I mean, it doesn't have to redo the whole report, but if you could at least, I just think it'd be more
I
complete.
think so too. I think so too. So, all right, very good. And Ally, will you take care of contacting the consultant? And I can provide you with a copy of Ms. Lambert's email to me so that you'll know her correct phone number and her correct email.
Thank you.
All right, as far as new business then, we have just a couple of committees that we need to kind of renew. The finance committee, we need that set up because we'll be doing our budget soon. And last year, Mike, you were on the finance committee. Would you like to be on that again? Sure. Okay, so that's good. Our bylaws say that the chairperson and another person should be on that committee. So we'll go ahead with Mike, and I'll attend also. Thank you, Mike. And next, I believe toward the end of this year, Ally will have been here for 1 year. And so that means that there will be a director performance evaluation that needs to be done. So I thought it would be good to have a committee to work on that. I don't think it should just be one person, but it is the Board of Health that will be evaluating the director. So is anyone here interested in being on that committee?
Sandra, this is Jess. I'm happy to.
All right, Jess and Patricia will join that committee. That's great.
Sandra, this is Anne. Of course, that's going to be done with our HR director, correct?
Correct.
Yeah, okay, thank you.
All right, very good. And then next on the agenda are board communication and reports. This is the opportunity for any board member to give a report or communication that they think is important to communicate with the rest of the board. So does anyone have anything to report today?
Yeah, Alexis's presentation is a good, I can dovetail into this a little bit. So where we were talking about the lock boxes, as some may know, the school building repurposed as a kind of think of it as an urgent care mental health walk-in center. We call it an access hub. Its formal name is a New Day. When I arrived back in middle of COVID, July of 2020, Hillcrest had written a proposal for what's called Certified Community Behavioral Health Clinic funding to SAMHSA, a federal grant, and they were awarded it. That was back when Francie Tischer was the interim CEO. It was a $4.2 million award for a 2-year period that ultimately got extended a 3rd year because COVID impacted the ability to both ramp the program up and then deliver services. A fair amount of that is in-person services. We used that grant at that time to effectively repurpose the school as a new day center, a walk-in clinic. It was a design determined by Hillcrest as proposed, in part in their bid. And toward the last 18 months of that work, we saw about 4,100 people come through that center in need of some form of mental health or behavioral health crisis or other types of services where they would be assessed and triaged and or referred to other Hillcrest programs or other programs in the community. This last week, we received notice from Senator Grassley's office. We had written again for an extension of CCBHC funding a couple of years ago, and we were not granted it. We hired a consultant to rewrite when the opportunity came, and we just received notice of award. And so we've got an expansion funds, $1 million a year for a 4-year period that will help continue to offset some of the costs at a new day, as well as other services that we provide, predominantly in greater Dubuque all the way out to Jackson in our Macokota service area. And it allows for some reimbursement of positions, infrastructure costs, and a fair amount of it is for underinsured and uninsured people to offset the cost of uncompensated care, with the idea that if we can get them into care, many of them are eligible for some form of assistance, whether that's Medicaid, Medicare, or the Obamacare type of health coverage. So that's just was a significant event. We received formal notice on Monday through SAMHSA of that award. And
How much did you say?
so that's $1 million a year, each year for 4 years. We have to do a fair extensive amount of reporting and follow through on that, and with success in that, it
And
can be
that's to
renewed.
support a new day.
That is not entirely to support a new day. A portion of those funds will help to cover some positions and some services that are not funded, that we don't receive funding, but we deliver through a new day. So it helps to, the ECR has also provided $550,000 of funding to a new day center along the same lines that they do for other localities that have access centers that have some comparable continuums of care. Ours cannot see clients over 24-hour periods, so we're a little bit different than that. We don't provide subacute care where the access centers do, but we're fairly comparable in terms of what we do offer in that walk-in center. And we've been running 8 o'clock in the morning to 8 o'clock at night hours. And this will also help us to further look at improving our availability and services in those hours and potentially over the weekends. So just wanted to give that update, since that wasn't really, didn't want to make it a public news until we were certain from SAMHSA in particular that Grassley's office was accurate in the letter to them.
So is it basically you're keeping it funded, or are you growing, would you say?
So it doesn't entirely, it allows us and requires us to do some things that are different, both geographically and in terms of additional services within the continuum that the original grant funded. There's also some complexity in the explanation of CCBHC because the federal government, in short, has underwritten the grants like this to providers in Iowa and other states throughout the country. At the same time, they've encouraged state governments afterwards to get on board with adopting CCBHC models that are in demonstration. So it's kind of an interesting squeeze play, as I call it, where you seed the providers and communities with services that have proven to be effective to a good degree, and then encourage the states to adopt those methodologies, which are in large part intended to move mental health in particular away from fee-for-service and look at other forms of payment that are more geared toward payment for performance or outcomes, or prospective payments that are based on the overall cost of care, and reducing the cost of care, especially for those Medicaid, Medicare, and other government-funded types of services.
Do you know, or do you keep statistics as far as a new day, where your clients come from?
We have de-identified capture information. We're not at a place because of HIPAA and other regulatory things that we can't, there's only so much information that we can specify, but yes, we can grab information or have information that can be cut that would determine, what parts of the community, zip code, that type of thing, what the breakdown is in terms of ethnicity and, utilization, what services are being utilized.
Thank you. Thank you for that, Mike, and congratulations.
Yeah, thank you.
Pat, anything? No? All right, good. Thank you. Jess, do you have anything you'd like to report? The baby sleeping all night or?
She's sleeping right now, but no, I have not attended any meetings in the last
Okay.
month.
All right, thank you. All right, very good. Our next meeting will be, the regularly scheduled meeting will be October 18th, 2023 at 4:30. At this time, anyone may address the board on matters which are of concern to you and which are not agenda items. Please raise your hand, and once you're called upon, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and Iowa code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks will be limited to 3 minutes. Would anyone like to speak? I see one person.
My name is Diane Page Freiberger. I live in rural Dubuque. And I have a question, and this would go directly to your director in the IMT, Incident Management Team. And that is, if there's going to be any messaging coming out regarding the COVID booster shot. The public knows because it's been, put out there that there's a new booster available. And I have been getting many, inquiries to myself regarding that, but I'm also in a lot of the webinars to be able to provide that information. But to the general community, is there going to be any messaging regarding the COVID booster, meaning who's going to be able to receive it, which is out there, where they go for funding for it, which is different for each person, and also, is it available right now in Dubuque County? So just that, I'm just putting that to you. You don't have to answer it right now, but that's many of the questions that I'm receiving.
Thank you, Diane. Is there anyone else in the community who would like to speak? Seeing none, then it's time for adjournment. Is there a motion?
I'll make a motion to adjourn.
Okay. All those in favor say aye. Aye. Those opposed? Nobody's opposed. We are adjourned. Thank you, everyone.
Thank you,
Oh,
everyone.
look at the baby.
There's the baby. Oh, my goodness.
Thank you, everyone.
Beautiful.
Congratulations, Jess.
You taking good care of her, Jess.
Thanks, guys.
Congratulations to Jess and also to Mike. Writing that grant is a little bit like giving birth, maybe.
Yeah.
Credit to Janae and her team, Alexis, as a part of that.
Yeah, great. Thank
Take
you.
Good
care,
night,
guys.
everyone.
Does that